going to look at the trigeminal autonomic. The trigeminal autonomic cephalalgia. Trigeminal autonomic cephalalgia. So here we are looking at the types. So first we'll discuss the types and then we'll go in detail about each. So the types, it includes the cluster headache. So there is the cluster headache. Next there is also the paroxysmal. There is paroxysmal hemicranias. Paroxysmal hemicranias. Next there is also the short lasting. There is short lasting unilateral neuralgia form. The short lasting unilateral neuralgia form headache. So neuralgia form headache, and this is along with the conjunctival injection along with the tearing. So what does this totally amount to? This is totally, in short, it is known as the SUNCT. It is known as the SUNCT, standing for short lasting unilateral neuralgia form headache with conjunctival injection and tearing. Then there is also another type known as the SUNA. So this stands for the short lasting unilateral. There is neuralgia form. Neuralgia form headache attacks. So there is neuralgia form headache attacks, and this is along with the cranial autonomic features. Then comes the last type, that is the hemicrania continua. So we just discussed the types. Now let's dive in detail. So first, looking at this, we are first going to see the cluster headache. So the cluster headache. So let's dive deep into the cluster headache. So the cluster headache, it is mainly common in males greater than females. Then how is the pain? The pain is there is stabbing. There is stabbing, or it is known as boring pain. So how is the pain? Severity of the pain is excruciating. There is excruciating. The pain is excruciating. Now what is the site of pain? If you look at the site, it is at the orbit or at the temple region. So orbit of the temple region is where the cluster headache takes place. Then we are looking at the attack frequency. So where does the attack frequency see? It is about 1 to 8 per day. Next, when we look at the duration is about 15 minutes to 3 hours. And then when you look at the migraneous features, yes, there is symptoms of the migraneous features. So what about the alcohol trigger? Does the alcohol play a role? The answer is yes, the alcohol plays a role. So what about cutaneous triggers? The cutaneous trigger is false. There is no cutaneous trigger. Then when we look at the indomethacin effect, so in terms of the indomethacin, so in case of the indomethacin, there is no response. Then when you look at the abortive treatment. So what is the answer here? The abortive treatment is there is 100% oxygen. So 100% oxygen, as well as there is a sumatriptan. There is 100% oxygen as well as a sumatriptan injection. Next we are looking at the prophylaxis. So what happens in the prophylaxis? In prophylaxis, there is the chronic cluster. So under chronic cluster, there is lithium, there is verapamil, as well as there is methyl seride. The methyl seride. So we saw lithium, verapamil, as well as the methyl seride. Next, Next, we are looking at the episodic cluster. So what about the episodic cluster? So episodic cluster, it includes, there is steroids, there is verapamil, as well as the methylceride. So it's the same, almost the same. Then we jump to the paroxysmal hemicrania. So now we already saw the cluster headache is over. Now we'll look at the paroxysmal. Next we are going to look at the paroxysmal hemicrania. So in terms of the paroxysmal hemicrania, it is the female is same as the males. F is equal to M. Then when you look at the type of pain, so how is the pain? The pain, if you see, there is throbbing pain. There is throbbing pain. There is stabbing pain, as well as it is also known as the boring pain. So the pain intensity is that there is excruciating pain. There is excruciating pain. And where is the region of the pain? So if you look at the region of the pain, it includes the orbit. So the orbit region is involved, as well as the temple region is involved. Next we look at the frequency. Frequency is about 1 to 20 per day. And how does the duration? The duration is about 2 to 30 minutes duration. So then what about the migraine features? The migraine feature, yes, it is migraine feature. Then what about the alcohol? Is no, there is no alcohol trigger. Whereas in cluster headache, there was something known as an alcohol trigger. Now, when you're looking at the cutaneous trigger. So what is this cutaneous trigger? So in terms of the cutaneous trigger, there is no. The answer is no. And then when you look at the response to the indomethacin. So indomethacin response is yes, there is a response to the indomethacin. Next, we are looking at the abortive treatment. So what is the abortive treatment for this? The abortive treatment for the paroxysmal hemicrania. So there is no effective treatment. There is no effective treatment. So what is the prophylaxis? Prophylaxis is nothing but there is indomethacin. There is the prophylaxis treatment. Lastly, we are going to see the SUNT. We are going to see the SUNCT as well as the SUNA. So SUNCT as well as SUNA. So as we discussed, we know the SUNT is nothing but the short-lasting unilateral neuralgiform, short-acting unilateral neuralgiform headache. So it is a headache, and this is with a conjunctival injection and also the tearing. So this was the feature. Next, we saw the SUNA. So what was the SUNA? The full form, it being the short-acting. So it is a short-acting, short-lasting unilateral neuralgiform. The short-acting unilateral neuralgiform. So it is a neuralgiform headache, and it attacks what? It attacks the cutaneous. It attacks the cranial. The cranial autonomic features. It involves the cranial autonomic features. So now let's read this in detail. So the SUNT or the SUNA. So here it is common in the males. It is equally present in the males and females. So how is the pain? The pain includes, there is a burning pain, there is a stabbing type of pain, as well as it may be sharp. So how is the severity of the pain? It can be severe. It is severe to excruciating. Severe to excruciating. So where is the pain of SUNCT as well as SUNA? The pain is around it is periorbital. The pain is periorbital. So now comes the question of the frequency. How is the frequency of the SUNCT as well as SUNA? The frequency, if you see, it is about 3 to 200. So it is 3 to 200 per day. So how long does it last? It lasts to 5 to 240 seconds. So this is in second. So the longest one was in terms of the cluster headache. So now we are going to look at some components. So what about the migraine features? So migraine feature is, yes, there is migrainitis features. Then what about the alcohol triggers? Alcohol triggers is no, there is no alcohol triggers. Then when you look at the cutaneous trigger, so the cutaneous trigger is also, it is present. Cutaneous trigger is present. Then we look at the response to the indomethacin. So when you look at the indometh, the response to the indomethacin, so the answer is no. Next we will look at the abortive treatment. So what does this abortive treatment include? So in terms of the abortive treatment, this includes the IV lidocaine. So there is IV lidocaine. Then when you are looking at the prophylaxis, how is the prophylaxis? So prophylaxis, it includes, there is the lamotrigine. There is lamotrigine. Next there is topiramate. The lamotrigine, topiramate, as well as the gabapentin. So gabapentin, topiramate, and the lamotrigine. Now let's see some more points. So some important points we need to know is that the indomethacin, the indometh. So the indomethacin, so this indomethacin is effective paroxysmal hemicrania. This is effective in terms of the paroxysmal, the paroxysmal hemicrania. So it is involved in case of the paroxysmal hemicrania. Paroxysmal hemicrania. So next, when you look at the hemicrania, and there is also the hemicrania continuum. The hemi is present in the hemicrania continuum, and also the primary sexual, as well as there is the exercise. There is sexual as well as the exercise headache. Now when you're looking at the cutaneous triggers, we are looking at the cutaneous triggers. So the cutaneous triggers is also seen in case of the trigeminal neuralgia. Seen in trigeminal neuralgia. However, the trigeminal neuralgia is a separate entity and not a part of the trigeminal autonomic cephalalgia. So we need to know that this trigeminal neuralgia, it is a separate entity and it is not involved with the TAC. So this was all about the trigeminal autonomic cephalalgia. So we have totally seen we have discussed the types, we have seen the types in individual level, we have seen more details such as where it is common, whether migrainous features are there, whether the severity of pain, the site of pain, the frequency of pain, as well as seen the prophylaxis. Next, we have also seen some important medications such as the indomethacin, where it is effective. So to learn and grow daily like this, please do subscribe.